Social prescribing cannot be overemphasized. People need to be listened to. People want to take control and charge of their well-being.
When a GP is sitting in a consultation with a patient, it's often clear that their needs can't be met by purely medication or a referral to another medical service.
As a clinician, we have a checklist in our mind when we're seeing a patient. Is this person need an admission to hospital? Is this person got a cancer? And now I think added to that checklist is now, would they benefit from a social prescriber?
The challenge in North West London is when you see people going to the A&E or people with sort of complex sort of medical problems, 90% of the needs that are presented by people in healthcare and in social care is what social prescribing is there for to support.
What is the real issue with the patient? Is there something deeper at home? Is there a social problem?
So often with a GP, they have limited time, so they're not able to actually look at what matters the most to the patient.
And giving patients time is so important.
Social prescription enables us to think in a much more personalised way about what patients' needs are and to meet their needs.
Part of social prescribing is not trying to direct people back towards the GP surgery, is directing people back out into their communities where the resources already are.
Social prescribing is that missing link that enables that person to set those really good goals and actually get them into the right services.
Your help with debt or your help that's making you feel lonely, the answer's there in your community, but you don't know about it. And actually the evidence is you'll do far better if you're linked back into your community.
The patients that are phoning every week, they mainly need someone to talk to. They need just to hear a human voice talking back to them, listening to them, acknowledging them.
That then takes the pressure off the NHS in terms of allowing the patient to deal with their medical problems that the NHS can do really well, and enables that patient to get what they need from that wider ecosystem.
It will reduce the amount of patients presenting to general practice as they realise their needs can be met in their community. And also it means that we can actually improve their health.
In North West London, social prescribing absolutely helps alleviate a lot of these pressures.
Social prescription is about empowerment, to get these people the confidence again to take more control in their life.
By doing some health coaching with them, they find out what they can do, and it's like a partnership, getting people to open up and talk about what's important to them.
In general practice, our need for social prescribers has ballooned because of COVID. So patients who were previously vulnerable are now even more in need. They are more isolated, they're more lonely.
Without the social prescribers, particularly during COVID, it would have been a lot more difficult. They would have involved a lot more time from our point of view.
People need to know how they can survive this pandemic and how they're just having someone to listen to you and hold your hand, that you're not alone in this and you're going to get through this. We all need that assurance one way or another.
With the pandemic, we concentrated on those vulnerable patients and those so-called shield patients that had clinical needs. So our social prescribers came into their forefront for that period and still are.
It's shown that the need for social prescribing is out there, it's bigger than ever, and the challenge is to find the services to provide those needs in people's communities.
It's about actually what's making the biggest difference for people in their day-to-day lives. And when people are able to go to work, people are able to get out of bed every day, then they're able to actually care for their families, and then they're able to feed their families. And they're able to do all these things. And this is all the things that we need to do in order to have a healthy society and healthy communities.
I would say to any practice that has not engaged with social prescribing, you need it more than ever, because at the end of the day, it's the well-being of people we're after, and it's very important.